Yes, a very good morning to you, ladies and gentlemen. I am honored to be invited to the first ever Media and Diabetes Advocacy workshop. As stakeholders, we need to maximize the utilization of both social and traditional media to improve diabetic care in all aspects, from prevention of risk factor that lead to diabetes to controlling diabetes and preventing the dreaded complications. As the Latin poet Marcus Martilius said, life is not merely being alive, but being well. Ladies and gentlemen, in Fiji, 15% of our adult population have diabetes, and another 15% have impaired fasting glucose. And this is taken from the latest STEPS survey carried out in 2011. Impaired fasting glucose means these people have high blood sugar and are at risk of being diagnosed with diabetes. Having said that, ladies and gentlemen, the lower limb amputation occurs every 8 hours as a result of poorly treated infection due to poorly controlled diabetes. That is, 3 lower limbs amputations per day. According to a study, it also done by our own doctors at the Pacific Eye Institute in 2011, shows that diabetes, eye disease, is worst in adults who did not know that they had diabetes as compared to those who knew they had. Indeed, these figures are alarmingly high, yet this is the reality. The 3 leading causes of mortality and disability in Fiji is ischemic heart diseases, diabetes, and stroke. These are NCDs that can be prevented through modifying our lifestyle through a healthy diet, being active, quitting smoking, having enough sleep, and so forth. The increasing incidence of complications due to diabetes is clear evidence that there is a need to alternate measures to combat this avalanche. It is also imminently necessary for diabetics to take ownership of their ailments and be actively involved in managing their diabetes. Due to recent technological advances, more and more people are relying on new communication channels, such as online information and social media, than traditional messages on television and in print media. Consequently, there has been a growing effort to introduce efficient means of implementing electronic and digitalized processes in healthcare. This correlates with the high use of smartphones and the popularity of mobile phone-based apps developed for virtually all aspects of life. Social networking is dominated by apps such as Facebook, Twitter, Snapchat, Instagram, and YouTube, with millions of subscribers. These apps have provided a means of communicating quickly and efficiently with the masses at minimal cost in a very short period of time. In healthcare, social networking is garnering more users, and its benefits in educating patients about their disease, dietary requirements, and physical activity are already providing their worth. I would like to commend the organizers of this workshop, for it is a great opportunity that will enable the media organizations to acquire new skills and broaden their knowledge in terms of becoming advocates for NCD prevention in Fiji. I encourage each one of you to maximize this opportunity to broaden your expertise on how to efficiently report on NCD stories. And so we are all here to see how we can work together with the resources and skills we have to map a way forward in assisting our population to be more health literate. I would like to thank Mr. Tabish Akbar and his team at the Diabetes Fiji for having shared a vision in combating NCDs. We can improve diabetes outcomes, and we can improve our people's quality of life in our lifetime through our actions and our words. With those few words, thank you and God bless. Naka.